everybody should assume they have some degree of heart disease and live their life accordingly. Why do I say that? Because everybody does.
Hello, everybody, and welcome to Health Files with Dr. Miles. I am Tanner. I am here with my co-host and researcher, Katie, and as always, board-certified family physician, Dr. Miles. We hope you enjoyed the episode. For us lay people out there, let's back it up just a little bit and let's figure out, okay, what exactly are we talking about with cholesterol? Cholesterol is bad for you, but then I hear there's good cholesterol, bad cholesterol, high density, low density, different shapes. So just kind of break it down for me, the lay person, as far as what exactly cholesterol is.
Katie, why don't you tell us, first of all, what is cholesterol?
Cholesterol itself isn't necessarily bad. It's biosynthesized in all animal cells.
So animal products have cholesterol, and animals use it.
Mm-hmm. It is a sterol, which is a lipid molecule, and it's actually a precursor molecule in your body for the production of different hormones, specifically the steroid hormones, for vitamin D and for bile acids. So your body uses the cholesterol molecule to create these other things that your body is using. So it's not necessarily bad, but bad if it's too much. Your body needs some of it in order to function.
So it's being introduced through animal fats? Is that
actually your body makes its own cholesterol? Yes, you can get it from the diet.
Okay.
But most of the cholesterol in your body is produced in the liver, in your own liver. So that is what cholesterol is. And Katie mentioned these anabolic steroids and things like that. We've talked about testosterone and people shooting up anabolic steroids and turning their blood into sludge and things like that. These cholesterol molecules are actually made in the liver, and when needed by your body, it takes this cholesterol and turns it into testosterone and these other steroids in appropriate doses. The cholesterol also helps stabilize the cell membrane, so the things that hold your cells together are composed of different things, including cholesterol. So you need these things.
So you need cholesterol to survive, but it needs to be in moderation. So that still leaves me a little bit in the gray or the fuzzy area as far as what is good cholesterol and bad cholesterol, because I have heard both. Is there such a thing as good cholesterol, bad cholesterol, or are they all the same and it's just the amount that it comes in?
Kind of. When we look at cholesterol, what we do is we get a lipid panel on somebody. And within the lipid panel, there's 4 numbers that are given.
It looks at your total cholesterol, your triglycerides, your HDL or high-density lipoproteins, and your LDL, the low-density lipoproteins.
So within that, the total cholesterol is obviously the total amount of cholesterol that's in your bloodstream at any given time. The triglycerides are the fats that are floating around your body. So if you go and drink a bottle of olive oil, those fats are going to be seen and your triglycerides are going to get a spike. Now the LDL and HDL, that's when people start talking about the good cholesterol and the bad cholesterol, good cholesterol and bad cholesterol. And Katie broke it down what those letters stand for: low density lipoproteins and high density lipoproteins. Lipoproteins are kind of like carrier molecules for the cholesterol. And so the low density kind are the ones that promote heart disease, the ones that promote cholesterol to build up within your artery. So it's taking this cholesterol that's floating around your blood and it's delivering it to your arteries, and it's causing the bad plaque buildup.
It's places you don't want it to go because that can lead to coronary artery disease. And on the other hand, the high density lipoprotein is actually thought to carry cholesterol to the liver for excretion.
So it takes it from the vessels to the liver to get rid of it and metabolize it. The thinking has been for years that the HDL is always really good and the higher the better, and the LDL is really bad, and essentially the lower the better. There's some other things that go along with that, but that's the general rule of thumb. And I think if you're just looking at your cholesterol panel there, your lipid panel, that's a good way to think about it at first.
Now, I have had people tell me that exercise promotes higher levels of HDL. Is that truth, or is that genetically based, is where your HDL levels are?
There's definitely some genetic basis for it. However, there are definite things that we see that boost your health, and in doing so, will also boost your HDL, your good cholesterol. Exercise is one of them, and obviously exercise is good for you. So I'm going to encourage everyone out there to exercise every day, or at least almost every day.
Please.
Yes, and it will, in doing so, boost your HDL and help pull the plaque or the cholesterol out of the vessel so that you don't develop the plaque.
Now, I remember back in my days as a pharmaceutical representative, there was always a buzz, a talk about medicines being developed that would boost HDL and therefore nullify the damage and detriment being done by the LDLs, because the HDLs would come in and just dominate those. But I haven't ever really heard anything further from that. And that may just be that I'm out of the industry. But what has there been any more developments as far as boosting these amazing HDLs?
I remember talking to a drug rep. There was he probably wasn't supposed to be talking about it, but I read about it somewhere and was talking to the rep who had one of the cholesterol medicines, one of the traditional statins that we use. And I believe that Pfizer and Merck and several of the big pharmaceutical companies were developing a drug or class of drugs that all boosted the HDL. And for example, Pfizer was going to bundle it with Lipitor and sell it as their new drug, and it was going to have really big increases in the good cholesterol and really low drops, big drops in the bad cholesterol, and things were going to be all great, and they were going to cure heart disease. However, that was at least 10 years ago when I first read about that. And over the years, I will occasionally ask the reps about it, and they don't really have a lot of information. So then I go to the Google, like everyone else, and just kind of see what's going on. And almost all of them have been withdrawn from contention as a potential drug to do this. Unfortunately, here they are thinking that this medicine is going to save lives and decrease mortality, and I think that some of the mortality actually went up. So while higher HDL is good, it's not always good in the case of medicines doing that.
So we're not going to find the answer in a prescription. So let's just say I come in, you take my cholesterol and my HDL number is low, or a little bit lower than what you feel like it should be.
I'm going to tell you to do one big thing.
Exercise?
Exercise,
Okay.
Absolutely.
So there's no nutritional ways of pursuing HDL.
Certainly, certain fats in your diet are going to be more apt to raise the HDL and lower the LDL and have positive effects on your lipid panel. And those fats come from plants, and they're usually considered the polyunsaturated fats. And those are fats that you can find strictly in vegetables. Animals are going to have the saturated fats, which are going to probably do the opposite.
So if I make fried chicken with walnut oil,
Nope.
where does that put me?
6 feet under. Some studies show that a little bit of alcohol is okay and can actually raise your HDL. Again, this may be one of those effects we have seen with the medicines where it doesn't actually help you. So I'm not going to encourage everybody just to drink some alcohol to boost their HDL. Do it the old-fashioned way by exercising.
I can see coming in, getting your low HDL count, and then going on a weekend binger and being like, I don't understand what's happened. So I know that every time I've come in for my physical, they make me fast. They say that, I don't know, it makes for a more accurate reading. Is there a science behind that, or is that some sort of just sadomasochistic torture you like to put the people through where they just come in starving and they don't get out of here till like 11 o'clock and they're ready to just make a beeline for the worst restaurant ever? Or maybe that's just me.
We like to show that you can have self-control if you can actually do it. So if you can fast for 12 hours, then you can do anything.
There's a discipline behind it. I like to hear that. So please tell me that
yes.
there's other reasonings behind my own self-discipline.
Then it's not for torture. We don't like starving you. We have you fast for mainly 2 reasons. One is so we can get an accurate glucose or sugar level. And then with that, we also look at your lipid panel. Katie, you can tell us about the lipid panel, and some of those numbers are affected by fasting and some of them aren't.
Part of your lipid panel is not affected by if you fast or not, but some of it is. So for a physical, we like to have you fast. That way we can get an accurate reading on your lipids. The triglycerides are directly affected by meals. So if you eat before, your triglycerides are going to be high.
If I have somebody come in with a sausage biscuit and they say, I want my cholesterol checked, I'm thinking, This lipid panel is going to be thrown off, especially with the triglycerides.
So even with the 12-hour fasting period, could it get thrown off if, let's say, at like 7 o'clock, I do decide to eat a bunch of sausage and fried chicken or high-fatty foods? Could that still throw off the cholesterol?
I should tell you yes, but the answer is probably not.
Okay. It's all about the mind games with you.
So the triglycerides definitely can be affected. How about the total cholesterol, Katie?
It does not affect the total cholesterol or the HDL. But when they do, a lot of the times when they do the lipid panel, they find the LDL using a calculation, and that calculation uses the triglycerides. So if you have eaten, and that will affect your triglyceride level, which will affect your LDL level when it's being calculated.
So if you eat that sausage biscuit, come to the office and I check your lipid panel, your LDL may look a lot better than it really is. So it's going to give us a big false sense of security when really you've got garbage running through your arteries. So that's why we make you fast. There are direct ways you can actually measure the LDL without this calculation involving the triglycerides, and it probably would be pretty accurate, but it's a more expensive test, and it sure is easy and cheap to do this other lipid panel. And if I have somebody that I say, there is no way they're going to come back fasting, what I'll do is look at their cholesterol and their total cholesterol and their HDL. And if I subtract the HDL from the total cholesterol, that leaves you with your non-HDL cholesterol. If you subtract another 30 points from that, that gives you a pretty good idea of what their LDL will be. So it's just an estimate. It's not perfect. But when I need to, when I have to, that's what I do.
And that's going to be a tough patient anyway, because, I mean, if you've got a patient that literally can't go 12 hours without eating, when 8 of that is sleeping, I mean, that's going to be a tough road to recovery, no matter what the findings are.
I think most people can fast for 12 hours. The actual recommendations from the American Heart Association, American College of Cardiology say that very thing. If you have a patient and you want to check their lipids and they're not fasting, don't worry about it. Just go ahead and do it.
And just like in cholesterol, I've always kind of been understanding that there are people that just run kind of high levels of triglycerides as well, correct?
Yep, there are.
Now, what causes that? Because that's the fat in the bloodstream, right?
That is the fat that's in the bloodstream, and it's not a good thing.
Well, there is actually a condition called Metabolic Syndrome, and that's kind of a combination of things that put you at a higher risk of developing cardiovascular disease and diabetes and things like that. And
what kind of things are they?
They are high triglycerides, which we just talked about, low HDL,
low good cholesterol,
high blood pressure, increased blood sugar, and an increased belly fat.
Increased belly fat.
So now,
by the way, this is the classic diabetic patient that I see.
No,
they've got the central obesity, they've got the low HDL, they've got the high sugars, they've got the high blood pressure. They are a walking time bomb. And these patients that patient that I just described to you has the equivalent of having a heart attack, as does someone who has already had a heart attack.
Wow.
Yes.
So you said central obesity.
Yes.
What does that mean?
The belly fat.
Okay, belly fat. Well,
the fat that's accumulated, the people that are shaped like apples, the people that have the big guts, as opposed to maybe the women who are shaped like pears and store their fat in their thighs.
Okay.
And bottom.
So there's a definitive more danger to carrying your fat in your stomach.
Absolutely.
Than it is. Well, I feel like this is a sexist disease because I see a lot more men carrying around with big bellies than I do women.
And surprisingly, men are much more apt to have cardiovascular disease at an early age.
Oh,
I know.
This is a sexist disease. I'm contacting someone for
it's
something.
Okay. It's okay.
Is there an HR department here at Health
women have
Files?
to give birth, so you could try doing that or having a period or something like that. No.
I want to see Tanner give birth personally.
Well, so that
really.
No, I could be wrong, but it seems to me that the description that you described.
Yes.
So
Metabolic
high
syndrome.
blood pressure, central obesity, cholesterol. I mean, you're pretty much describing what feels like 80% of American men over the age of 40.
Yeah.
For sure.
So
Majority of our population.
It is, and that's exactly why heart disease has been on the rise. Despite all our great cholesterol medicines and all the great knowledge that we have on how to treat cholesterol and prevent heart disease, people aren't listening. they're not following through. Maybe they're listening, but they're not getting motivated, staying motivated, and following through.
So is there a checklist of severity? What if you have 2 out of 5, 3 out of 5?
I think each one adds more to it. Yeah, I do. The number is 3 to qualify for metabolic syndrome, though.
3 out of, and how many?
I think it was
there?
5.
5 or 6?
I think it was 5.
Yeah.
Okay, Tanner, here is what I tell people who are concerned about things like this. First of all, regardless of your numbers, regardless of your scans, regardless of your exercise stress test results, everybody should assume they have some degree of heart disease and live their life accordingly. Why do I say that? Because everybody does. And it may be a small amount that won't be found on a lot of these tests, but could still cause you to have a heart attack in the next several years. And so I think everybody should live that way. They have found through studies in the Korean War with 18-year-old soldiers that heart disease starts at a very early age. And the best way to prevent it is to go ahead and assume that you already have it and eat a healthy plant-based diet and get plenty of exercise.
So let's circle back to our conversation we had at the beginning of the show on getting into a good exercise and healthy diet
So
routine.
maybe this will provide the motivation that
For you to
Lincoln
break the
Park
habit.
can't provide.
I tell you what, I can't think of a single episode that we have had where by the time I'm leaving that episode, I'm not ready to make some sort of change or alteration, usually around vegetables and whatnot. I need to find something that's going to make that more lasting.
Yes.
Rather than the 1 to 2 days or hour and a half after the show ends that I make that commitment to eat more.
I'm going to start texting you.
Yeah.
Start sending you your cholesterol numbers and say, Tanner, you're going to die.
I don't think
Think
I've
about
ever
this
had any high
before you put that in your
cholesterol.
mouth.
Maybe a little bit. I think it was up there for a little while, but
Hey,
I
you're usually
think
pretty
the
good.
cholesterol is usually pretty good. It's that blood pressure and whatnot that you got to keep an eye on.
I mean, I
But
think either
I
way,
consider that the stress of being a superstar.
it wears on you.
It's
And
just
either way-
it's a tough load to carry. The paparazzi, all the fame that's come from this show.
That's true. That's true.
So what can we take away from this episode? We learned that rarely in life, with the hustle and bustle of this world, will you ever stumble onto good health. You've got to be intentional. So get out there and pick up your meals, get in the gym, eat your vegetables, and break that habit. We learned that the saying 3 out of 5 ain't bad doesn't necessarily apply to metabolic syndrome, where 3 out of 5 is actually bad and carries a diagnosis with it. We learned that when it comes to cholesterol, the bad is bad and the good is better than bad, but may not be necessarily good. But for the purposes of simplicity, we're going to call it good. You have been listening to Health Files with Dr. Miles. We hope that you enjoyed it and were able to learn about achieving and maintaining good health. We really want you to subscribe to our show. It's continued to grow, but we really need you out there sharing this with your friends and family so that they can also enjoy the latest and greatest in the news of medicine and health. This show was hosted by myself, Tanner. My co-host and researcher was Katie. And of course, providing medical expertise, we have Dr. Miles, board-certified family physician. Visit our website, healthfilesradio.com, to learn more about us, our show, and the specific resources we used on each topic. And be sure and send us any questions you may have to questions@healthfilesradio.com.
As always, we are here for education and entertainment. You should take our recommendations not as specific medical advice, but as powerful knowledge to review with your own doctor, since you as an individual have your own unique health issues and needs.